50 children to get lifelong access to free Roche drug for SMA treatment, Bangalore, 14th November 2024, Care and Protection of Children Trust, CPCT, a leading NGO committed to alleviating the burden of rare diseases, today announced the launch of a groundbreaking financial assistance initiative aimed at supporting children diagnosed with spinal muscular atrophy, SMA. As part of this landmark program, 50 children up to the age of 16 years in Karnataka will receive lifelong free of cost access to Risdiplam, a revolutionary oral treatment for SMA. CPCT has signed an agreement with Roche Pharma India to procure Risdiplam, the first and only drug approved by the Drugs Controller General of India, DCGI, for the treatment of SMA. Under CPCT's Free Medicine Access Program, FMAP, children will receive continuous care and access to treatment at Indira Gandhi Institute of Child Health, IGICH, Bengaluru. Mr. Lakshmi Kanthan, Chairman, CPC Trust. At CPC Trust, our mission is to ease the burden of rare diseases for children and families who often have limited resources. We strongly believe that every child deserves to be treated with the best available therapy and are constantly working towards addressing access barriers. We are sure that with the free drug support of Risdiplam, a disease-modifying therapy which can be administered orally in the comfort of one's home, these children will benefit immensely. We hope that this partnership in Karnataka will serve as a role model to scale the program in other states too. Shri Dinesh Gundu Rao, Honorable Minister for Health Family Welfare, Government of Karnataka, we are thankful to CPCT for coming forward to support 50 children suffering from SMA in Karnataka with lifetime drug support. This landmark program will pave the way for a brighter future for these children of Karnataka by giving them a fair and solid chance to battle a debilitating condition like SMA. Programs like these are in line with the state government.
Is currently planned to select 50 SMA patients this financial year. Patients can get their required Risdiplam medicine at Indira Gandhi Children's Hospital through CPC Trust FMAP program and Roche Pharma. A committee of experts from various fields has been constituted for this purpose. They will help select 50 beneficiaries so families of patients who need medicine assistance can approach Indira Gandhi Children's Hospital. There will be opposition in starting any project. Can it be done and will they? They will ask questions. We show the answer in action for everyone. We have a lot of good people to support us with their help. This project has been launched today. As time is short, I will conclude my speech with us.
Assistance and support for people who are having SMA. And we all know the problems that SMA causes and the disabilities and the difficulties that the children face when they are diagnosed with this disease. And also the cost of care is so high, and also not only financial but also emotional trauma the parents, the family members also go through. So, and of course it is a lifelong kind of a problem, and it requires medication which is of a very high cost. ಅದರ ಖರ್ಚು ವೆಚ್ಚ ಏನಿದೆ ಬಹಳ ಹೆಚ್ಚಿರುವಂಥದ್ದು ಮತ್ತು ಜೀವನ ಪರ್ಯಂತ ಅವರು ತಗೊಳ್ಬೇಕಾಗ್ತದೆ. ಸೊ ಇದು ಪಾರ್ಟ್ ಆಫ್ ದ ರೇರ್ ಡಿಸೀಸಸ್, ಜೆನೆಟಿಕ್ ಡಿಸೀಸಸ್ ಅಂಡ್ ರೇರ್ ಡಿಸೀಸಸ್ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ. ಸೊ ದಿಸ್ ಇಸ್ ಇನ್ಹೆರಿಟೆಡ್ ಡಿಸೀಸಸ್ ವಿಚ್ ಕಮ್ ಇನ್ ಯುವರ್ ಚೈಲ್ಡ್ಹುಡ್ when your infancy only. So it is a big challenge for governments, because for people who cannot afford treatment, for governments with our resources, where we can we do treat people who've got this kind of problem, but there is a certain limitation in our budgets, and lifelong treatments at high cost becomes a very, very difficult proposition for governments to fund it. And we're always looking for donors and supporters, and from CSR funding and foundations and philanthropists to do that, because we have so many priorities. If it is a high cost and curable disease, then I think it becomes easier for governments to support and do the. But these are something which which has really no cure as far as I know. But it can be sustained. They can be supported, and they can lead at least close to normal life. ಅವರು ಕೂಡ ಕಾಣೋದಿಲ್ಲ. ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಆಗ್ತದೆ, ಅದು ಕೋಟ್ಯಾಂತರ ರೂಪಾಯಿ ಕೂಡ ಖರ್ಚಾಗ್ತದೆ ಅವರ ಪೂರ್ತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳೋಷ್ಟೊತ್ತಿಗೆ ಅಲ್ವಾ? expenditure is there. So, the CPCT they have come forward to support along with our Indira Gandhi Institute and the Child Institute, which is a center for excellence for us, which takes care of all these rare and genetic diseases. And I want to thank them for coming forward to do this. I think many our family members gave this is giving them hope and giving them that the life of the child and so much of physical and emotional support apart from financial support you are giving them. So it is a wonderful thing that you are doing. I think you have committed to almost treating per year. Any number has been fixed?
50 patients.
50 patients in a year. This year 50 patients they want to take care of. That is a very big commitment. It's a very big commitment. And translate to almost quite more than I think 10 crores. 14 crores. So the commitment for this year is 14 crores. So ಇದು ಕೆಲವೊಂದು ಸಾಧ್ಯನೇ ಇರ್ತಾರೆ ಅಲ್ವಾ? ನೀವೇ ಇದು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳಿ ಅಂತ ಹೇಳಿದ್ರೆ ಈಗ ಸಾಧ್ಯ ಆಗ್ತಾರೆ. ಗೌರ್ಮೆಂಟ್ 50 ಲಕ್ಷವರೆಗೂ ಒಂದು ಲಿಮಿಟೇಷನ್ ಇದೆ. ಸಪೋರ್ಟ್ ಗೌರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾ 50 lakhs ಸಪೋರ್ಟ್ ಇದೆ. ಬಿಯಾಂಡ್ ದಟ್ ಆಮೇಲೆ ಅದು ರೀಚ್ ಆದ್ಮೇಲೆ ನಾವೇನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅದು ಒನ್ ಟೈಮ್ ಆರ್ ಫಾರ್ ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಸೊ ಈಗ ಈ ತರ ಮುಂದೆ ಬಂದಿರೋದು ಇವತ್ತು ಯಾರು ಆ ಮಕ್ಕಳಿಗೆ ನಿಜವಾಗ್ಲೂ ಕೂಡ ಬಹಳ ಇದಕ್ಕೆ ಇದರಂತ ಒಂಥರ ಪುಣ್ಯದ ಒಂದು ಅವಕಾಶ ಸಿಕ್ಕಿದೆ. ಖಂಡಿತವಾಗಿಯೂ ಈ ತರದ ಕೆಲಸಗಳು ಎಲ್ಲೂ ಹೆಚ್ಚಾಗಿ ಮಾಡಲಿ. ಅಂಡ್ ವಿಶ್ ದಿಸ್ ಪ್ರೋಗ್ರಾಮ್ all success and every support from our
it's a very good program, especially for the patients with SMA and the parents, especially whose children are suffering from this SMA. This being a rare disease, I have to thank CPCT for this good gesture. It's a great gesture from CPCT for having come forward to support nearly 50 patients. They are supported to the tune of 114 crores this academic year, for this year. And also Indira Gandhi Institute of Child is doing an excellent job by establishing a center of excellence for rare disease. And Government of India is also supporting for the rare diseases with 50 lakh rupees per patient. So, especially the Karnataka government is trying its best, and the Honorable Chief Minister has been very supportive, especially for health and medical education departments, for giving all the best possible healthcare, quality healthcare to the people of this state. And this being a special center of excellence where the diseases are being taken care of. So, given amount of Karnataka has contributed around 10 crores for this. And I'd like to thank CPCT for supporting this. And we look forward for the quality of life of the children